The doctor is in, and today's topic, we're talking about bone cancer. Cancer that starts in the bone is rare. What is more common is for cancer to spread from another part of the body to the bone. And joining us today to talk more about bone cancer is Dr. Scot Ackerman. He is one of the First Coast's leading oncologists. Dr. Ackerman, thank you as always for being here with us every week.
Casey.
So let's talk a little bit about bone cancer. Well, first of all, I mean, it's not one that you really hear a lot about in the news, but what exactly is bone cancer? What does it mean to have it?
Well, a lot of people talk about bone cancer. A lot of people know someone that has cancer, and if it's in the bones, they say they have bone cancer. So let me just clarify what bone cancer is and what cancer that's in the bone is, and try to give some clarity to this. So there's two ways that you can have cancer in the bone. The first way is when you have a primary tumor in the bone, meaning that cancer started in the bone itself, in the matrix of the bone. These are things like sarcomas, and they originate in the bone. Sometimes they're benign, but frequently they're malignant. You can have either one. And then there's the other situation where cancer started in another part of the body, like breast cancer, and spread to the bone, and that's a metastasis. It metastasized or spread from the area that it began, excuse me, and it's in the bone.
So how common are then the primary bone cancers?
These are very, very rare. So when someone says they have bone cancer, they probably don't. They probably have cancer that spreads to the bone. So these primary bone cancers make up only about less than 1% of all cancers. About a little over 2,000 cases of primary bone cancer each year. Things like chondrosarcoma, Ewing sarcoma, osteosarcoma, things you don't hear about a lot in the news.
Yeah.
So that's how rare these are. There's also another situation where you have cancer that begins in the bone marrow. This is much more common than the primary bone cancers, but still not that common, only about 14,000 cases a year. And this is a disease called multiple myeloma. It's a cancer of the bone marrow, not of the bone. And then the most common cancer that's in the bone is a bone metastasis, which spread from another area.
Okay, so let's talk about the metastasis, and then we have actually a picture, I think, that we're going to show of what that actually looks like. Is that what this is here?
So what you see there in that bone, and this is the humerus, this is the patient's left arm, and in the middle you could see an area here that's darker.
Yeah.
And that part of the bone has been eaten away by a cancer that spread there. So that cancer probably did start in another part of the body and went to the humerus. It kind of it went through the blood system. It kind of took root there, and it started to grow there. When cancers are caught early, they're still in the localized stage. But when they grow, sometimes some cancer cells can go into the blood system, and they go through the body, and they could and they're in the blood system all throughout the body. And so wherever there's a large supply of blood, like the liver, the lungs, the bones, that's where these cancer cells could be going through, and they get kind of filtered through these organs, and there's opportunity for the cancer cells to take hold in these other parts of the body. That's called a metastasis, when it goes through the blood system and takes hold in another part of the body. When it takes hold in a bone, it starts to grow, and it looks just like the cancer where it began. It looks like a breast cancer or a rectal cancer or whatever, and it grows in that bone, and it can weaken the bone. It could make it so that the bone fractures because the bone's weak. If it's in your leg, which bears a lot of weight, it could weaken the bone such that the bone fractures. And it could also, if it's growing in the bone, it could push out from the bone. So, for instance, if it's in the spine, in the vertebrae, it can grow out and push and give pressure on the spinal cord and cause paralysis.
Oh, goodness. Well, are there some cancers that are more likely to spread to the bone, like a breast cancer or colon cancer? Are there some, or is it really just depends?
Yes, there's lots of cancers that we see, and many cancers, luckily, don't have a propensity to spread to other parts of the body. Cancers of the larynx, we don't see them spreading too often, but cancers of the breast and cancer of the lung and cancer of the prostate have a fairly high propensity when they're in an advanced stage to go to the bone. So if we see someone, an older man who's of the prostate cancer age group, and he has a lesion that we see on that x-ray like that in his bone, the first thing we think of is that maybe he has prostate cancer. We check that first because these are the common cancers that spread to the bones. So again, it's important to detect cancers early before they have a chance to spread to other parts of the body, and so we have a higher chance of being able to cure those cancers.
That's what we talked about last week, how prevention is key, because a lot of times there aren't symptoms. And so if you get the tests beforehand, you might catch it and really nip it in the bud before anything has a chance to spread. So
Right, not just prevention. Prevention's part of it. We can only do so much to prevent, but it's early detection, so cancer screening. So that's what's really, those two hand in hand.
Yeah, that's I guess what I meant to say was, yeah, making sure that you're getting the colonoscopies and and the mammograms and whatnot. So what are the treatment options for bone cancer then? Do you treat it the same way you would other cancers?
Yes, we treat cancers with surgery and with radiation and with chemotherapy. We can manage these cancers depending on the kind of cancer it is. We see men with prostate cancer that's in their bones for many years. It could be a decade or so where it's in their bones and we're just managing it. So if it's a tumor, let's back up. If it's a tumor that began in the bone, that's treated usually surgically. If it's in the leg, you can remove it surgically. That's ideal is to take care of that surgically. Sometimes we add chemotherapy in those cases. And there's some new protocols where we treat these patients with chemotherapy and radiation to preserve the limb. In cancers that begin in the bone. In cancers that spread to the bone from other parts of the body, those patients are rarely treated surgically. We use surgery if the bone fractures because of that spread of the cancer, but usually they're treated with chemotherapy or radiation therapy. We also have some drugs that we give patients to help strengthen the bones so that the chemotherapy can work against the cancer, but this other drug strengthens the bones and helps protect and prevent the bone from fracturing.
All right. Dr. Ackerman, thank you so much for shedding some light on this. And you're going to be back with us next week, as always. And we appreciate you being here and sponsoring this segment. And again, Dr. Ackerman is with us every Friday. And next week, we're going to be talking about non-smokers and lung cancer. And for questions regarding today's topic and any other health questions that you might have, just visit firstcoastoncology.com and confidentially submit your questions to Ask the Doctor.